Hi, this is Wendy Briggs with the Case Acceptance Tip. One of the biggest mistakes we make in dentistry when we're trying to talk about options with our patients is we use too many complicated words. So the tip I'm going to share with you today is to keep it simple. Often when we go over treatment plan options, even when we're talking about one single solitary tooth, we give the patient too many choices. We need to ask the patient's permission to recommend what's best for them and then stick with that. Too many complicated words, all it does is confuse and overwhelm the patient, and they really don't feel like they can make any decision at all. So really what we need to have our team focus on is keeping things simple, and that's why we love to use the words mandatory, elective, and cosmetic when we're talking about patient options. Usually we categorize treatment into one of those three categories, and all patients everywhere, no matter their status, understand what those three words mean: mandatory, elective, and cosmetic. Another great thing that using these words do is it helps us open the door to have a conversation about what the cosmetic options are for this patient. We are able to ask them if they've ever considered cosmetic dentistry and if they'd like more information about any procedures or options that we feel might be beneficial to them. So keep it simple, stay away from the complicated, confusing terminology, words that you use every day. Your patients aren't going to understand in the same way that you and your staff do. So really focus on keeping things simple, making sure that you're using layman's terms with your patients when you're going over what their options are, and then you will find something magical happens. You'll do more dentistry.